know what is the social event that changed our society a lot significantly? What social event actually changed our world and then our life?
The Industrial Revolution.
Yes, industrial revolutions. What is industrial revolution then? Public health aligns with our social event, actually very closely related to each other. Our social event, social history, and public health history is very closely each other. Industrial revolutions. So we kind of develop the machines, right? And the machines actually produce the bulk product, right? And then factories, so at this time, we developed a lot of factory and produced a lot of product. And then these kind of things makes our life very convenient, right? We actually invented vehicles, right? Vehicles, car, and invented many things, right? At this time, due to these industrial revolutions, right? Yeah. These changes also changed our environment. In order to make the more money, people actually, where the people go to make more money. What kind of life changes made?
They go to work in the factories.
Working the factories, so usually factories actually located in urban city areas, right? Yeah. Many people actually go to the urban city to work in the factory and make the more money. So before this time period, our life is like kind of a countryside life. Farmers like kind of this kind of industries, farming like this kind of industry, but this time period, many people actually go to the urban city to work in these kind of factories. So what is going to happen? What happens in our environment? Many people live together like this in this class. What kind of things happens?
Disease spread.
Yeah, disease spread very easily, right? You guys actually sitting closely, right? In these environments, disease actually spread very easily and fast. If you guys are actually sitting one person here and that person there, not many density is lower. Probably disease hard to spread out. So that kind of social change our environment, living environment, and then this living environment also causes the many problems. Many people like kind of live together in a location, so cities overcrowded and water supplies in other case, and then unsanitary problems happens and workplace unsafety. Even though these kind of industrial revolutions change our life, make more convenient, but causes some unexpected problems like this. So from these 18th centuries, we actually uncount unexpected problems like this. Disease easily spread out. So that's why public health, the importance of public health actually begin from this time period. Also, we had a medical advance, like kind of discovery of vaccinations. Dr. Jenner's actually demonstrates the process of vaccination from a cowpox against the smallpox. Do you know the principle of vaccinations? How vaccinations work?
You introduce a small amount of whatever virus or disease.
Uh-huh.
Build up.
Okay, yeah, that's correct. So vaccines actually is the another virus. But it doesn't causes the disease, right? It doesn't cause the disease. So, but that kind of a friendly virus, vaccinations help us develop the immunities. And then that develop the immunities actually protect us from actual virus. That is the principle of the vaccination. Okay. So I actually here is the YouTube video link. So if you are wanting to watch this one, you can watch this video about the principle of the vaccinations. So as we're moving on to the 19th century, so we still have a higher population density in urban city areas. So epidemic problems actually occur from this time period. So do you know the definition of epidemics? Epidemics. Epidemic is defined as a widespread occurrence of disease in a community at a particular time. So only certain areas actually disease spread out widely. How about the pandemic?
The global?
Huh?
Global?
Yes, pandemic is the widespread of disease over the world, not only one location. So COVID-19 is a pandemic or epidemic? Pandemic, yes. So COVID-19 is actually disease spread out all over the world, right? So that is the pandemic. At the time, epidemic problems happens, but nowadays all the disease mostly likely pandemic. Why? Why those 19th century the epidemic problems more, but nowadays pandemic problems more? Vaccination probably, but try to think about our environment.
Regular travel part.
Yeah. Yes. Now, so we can travel anywhere, anywhere right now, right? Yeah. How the COVID-19 spread out? Because of the travel. We can travel anywhere, anywhere, right? Yeah. So the virus start from China, but the people in China is actually they travel the Europes and Americas and many other countries, and then the disease spread out like that way. So public health problems are actually really closely related to our living environment. So nowadays, disease really easily spread out. So that's why public health is very important, right? Yeah. So modern era of public health begin from 1850, especially Dr. John Snow first found and used the epidemiological scientific approach to treat epidemic disease. So I highlighted the yellow epidemiological scientific approaches. What is scientific approach? What is the meaning of scientific approach?
Experimenting?
Very close. Experimenting things. In order to experiment, what do we need to do? Yes, develop the hypothesis. How we can prove your hypothesis? Experiment, and then how we do the experiment, and then what we gonna do? That experiment, what we gonna get? doing experiment, what we gonna get? Result, yes, result, how we got the result? By getting this, what is this? Yes, data. Scientific approach means collecting data, set up the hypothesis, and prove the hypothesis by experimenters, and then eventually we getting data. And then analyzing data, and then conclude. That is the scientific approach. So we actually use these scientific approaches to address these epidemic problems from 1850. Dr. John Snow and numerous Shattuck's report is the first generation of using these scientific approaches to address the public health problem. Okay? Scientific approaches. Please keep in mind what is scientific approaches: collecting data, set up the hypothesis, and then doing experiment, and then collecting data, and then analyzing data and make the conclusions. Okay. So numerous Shattuck's report, actually this is the kind of sanitary survey based on the scientific knowledge. So collecting the data, statistics. So this based on this survey, so this report actually recommended the 50 standard of the public health standard. So it becomes actually American public health practice right now. So Dr. John Snow and numerous Shattucks were the first generation to use the scientific approaches. Okay, yeah. So 19th century, 20th century, so we begin to develop the many public health resources, such as regulation policy, and then we also develop the facility equipment. And we also establish the medical schools to educate health professionals, and also we develop the public water and sewer systems. As you can see, in other case, water and sewer system actually causes the disease, right? At the time, sewer system and the water supply is actually closer together, right? But these sewer systems actually, some virus and the germs actually transport to this water supply, and then people drink water and then getting disease or something like that. We also developed these public water and sewer system from this time period, and hence insurance system. We also developed the health insurance systems like this. So let me talk about the brief history about these kind of public health resources. We have some behind the story that we developed these kind of resources. Okay? Yeah. First things. Do you know what is this? This one. Liberty Statues, right? Have you been guys in New York before to watch this one? Yes, good. Yeah. So do you know what these Liberty Statues represent? Liberty Statues. What these Liberty Statues actually represent? At this time, beginning of the 20th centuries. It represents the American dreams. Do you know why this one represents the American dreams? Many Europeans immigrants actually came to United States to make more money, better life, find a better life. So when they came into the United States, the first time they're gonna see is the Liberty Statues. And then when they watch these Liberty Statues, and then they make the dream, better life or this kind of thing. So these represent the American dreams. So at this time, many Europeans, actually immigrants, actually came to United States and then make more money and then better life. So they usually working in food factory, food industries. So these food industries that many European immigrants actually work in this food industry at this time. So do you hear about the Navar's jungles? The title of the Navar's is the jungle. What is it about that?
I've heard of it, I don't.
Okay, yeah. So the Navar jungle is about the describe the food industries, how the European immigrants actually hard to work in this food industry. Their unsafe, their working condition, these kind of things. But unexpectedly, these novels actually reveal the poor and unsanitary food industry in the United States. So let me show this video a little bit. So these numbers unintentionally reveal our unsanitary, poor, meat packing industries. How do you feel about that? Do you wanna eat meat? So what kind of things we need to do then? If we know that this? What kind of things we might need to have?
Better regulations.
Yes. At that time, we did not have any regulation about food industries. So that's why there is no regulation about managing or storing and then like kind of this kind of meat or food industries. So people's like kind of really mad about our food industry, and then these novels actually contribute to the establishing the Pure Food and Drug Act. So we established the regulation about our food from this time period. The Navar's jungles actually made a huge contribution to developing these act regulations. So due to these regulation, food regulation, every restaurant, every food factory followed their regulations, like how the sanitary things, or these kind of things. So without these regulations, our food industry was unsanitary, but these kind of novels actually contribute to the establishment of this act, right? Yeah. So these kind of include the removing harmful and misrepresent food and drugs from the market and regulate the manufacturers and sales of drug and food. Okay, so we developed the regulations from this time period. Okay, good. And then the birth of public schools in America, we actually also established the public health schools, like kind of a nursing program and physician medical school from this time period. The first nursing program was begun in New York City in 1918. The first school of public health, Johns Hopkins University in Baltimore, 1923, and Harvard School of Public Health. These schools actually educated public health professionals like physicians, nurse, and other like kind of public health professionals. So they kind of help and develop the treatment and then develop the way to prevent disease or something. So we actually established the public health schools from this time period. And then the Great Depression. Great Depression also influenced our development of the public health resources. Do you know what is this? Great Depressions? It's a history, right? Our histories. Great Depressions. So our economy is really like kind of lowers, right, at the time. How we broke the Great Depressions? What was the solution to break through these Great Depressions?
World War II.
Huh?
World War II.
World War II, probably, yes, but the President Roosevelt actually adopted this policy. What is that? Probably you hear about the New Deals. New Deal is the policy that President Franklin Roosevelt actually adopted to this break the Great Depressions. So basically, New Deals. So economy is so lower. What the government needs to do that? Economy is lower, so many like kind of people lost the job, do not have jobs. So the what government needs to do that? Yes, create the jobs. So government actually to create the job spend a lot of money to build many infrastructures. So at this time, we build water and sewer systems. So that's why this kind of work and then this kind of a policy create many jobs, right? So we construct a hospital, laboratory, water and sewer system that actually create many jobs, and then we can went through go through these Great Depressions. So at this time, due to this Great Depression, we developed many public health resources, right? Hospitals and public water and sewer systems or something like that. Okay. And Social Security Act from in 1935, government began to involve in social issues such as maintenance and child health. We actually government also begin to interest in some kind of public health issues, especially for mothers and child health from this time period. And World War II. So you mentioned the World War II. How the World War II can contribute to the development of these public health resources?
It helped increase the amount of products we were selling out to other countries.
Yes, so we actually at this time developed many medication things. You know, World War II actually many soldiers actually got injured. We need to treat, right? So we need to develop the many medications. At this time, we developed the antibiotic things. So we kind of developed the many medications, also advanced the many like kind of medical equipment, these kind of things. Yeah. So this kind of social event is associated with the development of our public health, right? Yeah. Also, at this time, we established the Center for Disease Control, CDC. Probably you hear about this organization, CDC, which is the premier epidemiological center of the world. So CDC usually collect the data and then analyze data and then make some policy, public health policy based on those kind of analysis of the data things or something. Okay, so until now, until this time period, we developed many public health resources like this. And then moving on to 1960, federal government became active in health disparity matters. Why this time period the health disparity matters happens? You think? Why you think the health disparities matters happen in this time period? Rich and poor, this matters at this time. Why this time period this kind of things happen? There are some regions still actually going on until now, but why this happens? There is always regions why this happen, disparities happen at this time period.
The poor people can afford it.
Yes, the poor people cannot afford it. As you can see, we developed many public health resources, right? Advanced, medical, like kind of a medication thing, equipment things, and the hospital things. But we invest the money. What we want to do? Invest the money on that. What we want to do? Make money, right? So make the profit. In order to make the profit, what do we need to do? Probably health cost increase. Yes, I actually wanted to buy this computer to teach, and then I want to make the profit, right? So probably I receive the more tuition to instead of the buy this one, right? In return, buying this, right? Yeah. Always invest money, try to make the profit, and then increase the cost eventually. That is the kind of a principle. As you can see, we developed many public health resources, spend money, and then make the profit, and then there's the health disparity happen. If you are rich, you can enjoy this kind of advanced public health resources. But if we are not rich, probably it's not affordable to have these kind of resources. So many Americans did not benefit from this medical advance, so health disparities in lower income and elderly people, older peoples, actually it's become an issue. So the government established the Medicare and Medicaid, which is the public health insurance. So this one is the Medicare and Medicaid is for the lower income people and older other peoples, like kind of public health insurance that help them to access the healthcare service. Unfortunately, we put a lot of dollars to actually accelerate the rate of the increase of cost of healthcare. We still struggle to deal with the healthcare cost. I'm going to talk about these issues in our last topic, health insurance topic. But as we put more money, healthcare costs increase because of this. Probably, I think that you guys are actually still young, so your insurance is under your parents right now, right? Yeah. But after 25, you need to pay your own health insurance. Do you know how much I need to pay every month to get the health insurance? For entire my family, I have a wife and daughter, one daughter, so 3 people in our family. How much I need to pay? 1,600 per month. It's reality. Yeah. But every month, every year, so these healthcare costs increase. So we're going to talk about this topic later, but we still try to reduce these health disparities, but as we develop the many public health resources, but unfortunately, healthcare costs increase, so health disparities matters actually happen this time period. And then CDC identified the factor of the premature death. Premature death is a death prior to 65. And then this premature death is related to lifestyle and health behaviors, like kind of lack of exercise, unhealthy diet, and smoking, stress, or something like that. Lack of exercise, unhealthy diet, smoking, stress. This is the kind of risk factor that related to premature deaths. What is the common things of these risk factors? Lack of exercise, unhealthy diet, and smoking and stress. What is the common things? What is the common things? These risk factors can be prevented. So these premature death is related to our lifestyle and health behavior that can be prevented. So 50% of premature deaths can be prevented. So our health paradigms actually change from treatment to prevention from this time period. So many premature deaths and death is related to these risk factors that can be prevented. So our paradigm from this time period changed from treatment and prevention. So that's why public health focus more on prevention, because of these over risk factors actually can be prevented, right? So we changed our paradigm, public health paradigm from treatment and prevention. Okay. So we look at our brief history of public health. So 18th century, 1800, we used the scientific approach to address the public health problem, and then we developed many public health resources. ironically, public health initiatives actually cost increase the healthcare cost and then as disparities happen from this time period, and then we try to address these health disparities. Also, we found many premature deaths is actually can be prevented. So our paradigms change from treatment to prevention. Okay. So